Good evening. So I'm Preeta Harikrishnan, your host and moderator for today. As the Deputy Manager of Admissions at Amrita Health Sciences Kochi campus, I'm thrilled to welcome you to this insightful session on anesthesia technology. Thank you for joining us. So we are expecting more of them to join us soon. Today, we aim to shed light on the numerous benefits of our anesthesia technology program. So please feel free to share your doubts in the chat box. We'll make sure to address you at the end of our session. Allow me to introduce our distinguished guest for today, Dr. Shyam Sundar sir, a highly esteemed medical professional. Dr. Shyam sir holds an MBBS, DA, and DNB in anesthesiology. He has been a valued member of the Amrita Institute of Medical Sciences, Kochi since 2003, where he has advanced from senior resident to additional professor. Dr. Sundar sir is also a fellow of the College of Critical Care Medicine and holds the prestigious European Diploma in Intensive Care. His clinical expertise spans advanced respiratory support, including ECMO, complex weaning processes, nosocomial infections, and neurocritical care. Please join me in extending a warm welcome to Dr. Shyam sir as he shares his valuable insights with us today. Welcome, sir, to this webinar.
Thank you, Preeta, for the nice
Thank you, sir.
So can I proceed with our...
Yes, sir. Yes, sir.
Okay.
Yes, sir.
So welcome to all who are here present, aspiring candidates of B.Sc Anesthesia Technology. A warm welcome from the Amrita Institute and the Department of Anesthesiology at Amrita Institute. Anesthesia Technology is a specialty which has been there for almost 2.5 decades now, and it has progressed from being a diploma course, and then it has been upgraded to the level of a bachelor program, and in some places you also have a master's program in anesthesia technology. In some places and some institutes, the program is combined along with the operation theater technology. But in our institute, it's an exclusive anesthesia technology program. So first, let me highlight the B.Sc Anesthesia Technology course that is run by the Amrita Vishwapeetham Deemed University at Amrita Institute of Medical Sciences, Kochi. So here, the program, like any other B.Sc Allied Health Science, is a 4-year course, of which 3 years is the course and the 4th year is that of internship. The first year of the program, the candidates are combined with many other courses of allied health sciences, and they have common classes in the basic sciences like anatomy, physiology, and all other basic medical subjects. Along with all other courses, they'll have a combined theory class in the medical college. This is conducted by mostly doctors of the respective departments like anatomy, physiology, and all that. So for the first year, they have a full-fledged, college teaching, which is more of theory oriented. Of course, there will be practicals and hands-on sessions in that. And at the end of the first year, you will have a university exam. Total of 6 subjects are there, and you have to clear all the subjects individually to get promoted to the second year of the program. The second, third, and fourth years will be exclusively in the Department of Anesthesiology at AIIMS, Kochi. So you will be having a more of a practical oriented training. That's how we run the program here. You do have theory classes, which is interspersed over the weekdays and teaching timings. But along with that, you will have your clinical postings, as we call it, in the operation theater or operation rooms, as we call it. Amrita Institute of Medical Sciences has almost 35 operating theaters run over all the specialties, surgical specialties that you could think of, right from general surgery, gynecology, obstetrics, to advanced specialties like neurosurgery, cardiac surgery, gastrosurgery. And nowadays, we also have robotic surgery and transplant surgeries, which includes liver transplant, kidney transplant, hand transplant, and all these specialties are there. So as a B.Sc Anesthesiology Technology student, you will get exposed to almost all these surgical specialties and mainly anesthesia, how anesthesia is provided to that. So the primary aim of the anesthesia technologist is to assist the anesthesiologist, the qualified anesthesiologist, in providing anesthesia for the various surgeries that I mentioned just now. So the second year and third year, you will have again exams at the end of each year. So in the second year, you have two subjects along with two subjects from the first year. So you'll have four papers at the end of that year. The theory classes for the basic science program course, two subjects, as well as the two subjects of anesthesia technology will be there. That will be taken. And you will have daily morning till evening practical classes. Sometimes the practical classes or clinical postings can extend into the evenings as well. Subsequent to the second year course, you will have an university exam. And again, you have to clear the papers individually at the end of the second year to be able to be promoted to the third year of the program. And then you have the final papers, three papers of anesthesia technology in the final year. And also, along with this, you have a project work that you have to undertake over a 6-month period. You would be assigned a guide to conduct this project, and it will be an individual project. So each candidate gets to do a project all by themselves, guided by the respective guides, and you will have to submit the project prior to the exam, final university exam. Once you qualify with this examination, then you will be promoted to do the internship. Any candidate failing to clear all the subjects from starting from first year, second year, and final years will have to sit through and read up again, appear for the additional university exams that come up, and only then do they qualify to enter the internship. So you'll have to complete all the papers and clear them before you enter the internship. The internship is a 1-year program. So during the internship, it will be like any other medical field internship where you will get to do your clinical postings will include morning duties, evening duties, and night duties, and all that. So this is in an aim to train you all to what you have to face in future as a qualified anesthesia technologist with a B.Sc degree in your hands. So during this period, not only will you be, supervised and you will be given work. At some situations, you will also be given hands-on to do all by yourself the duty of an anesthesia technologist, so that you are really, qualified and skilled enough to perform the duties of an anesthesia technologist when you leave the institute at the end of the fourth year. Okay, and when it comes to the course, this is about the course. When it comes to the program as such, especially in the second and third years, you are not going to have more of a theory class. It won't be a classroom teaching like I said earlier. It is going to be a clinical posting, and classroom lectures will happen at regular intervals so that the theory portions are completed. But it will be more of a clinical or hands-on training. In the second year, you will be, mostly made to observe how things are done. Each candidate gets to be posted in a separate theater along with a qualified anesthesia technologist there, and will be observing that technologist who assists the anesthetist there in providing anesthesia to the patient undergoing the surgery. So there are a lot of equipments that you have to handle, a lot of machines, equipment, gadgets, monitors, so many different things are there. And there are multiple procedures that an anesthesiologist performs before the start of the surgery. During the surgery, a lot of monitoring happens. And at the end of the surgery, especially at the recovery of the patient, that is when our role becomes very crucial. And the anesthesia technologist is the one who, throughout all these stages, assists the anesthesiologist in doing all these procedures, monitoring, and all those things. So you will be exposed to all these gadgets and equipments, and you will see how they are to be handled. And this handling includes basic maintenance also, not advanced maintenance. Advanced maintenance of equipment and machines and monitors would be done by the biomedical engineering in each institute, but the anesthesia technologist is supposed to know the basic, maintenance of some of the important gadgets that are used. Some of the gadgets are used for emergency. Some of the gadgets are used for basic mandatory monitoring of the patient during the procedure. And some of the gadgets are for use for some specialized procedures. So you will be exposed to all these gadgets and equipments and anesthesia workstation and all that. Apart from that, you will also learn to handle the anesthesia drugs. As you all know, anesthesia drugs are potentially life-taking or if not handled in the proper way. So that is why you will not be allowed to handle the drugs in the second year and third years. And you will only be allowed to handle them during your internship. But during the second and third year, you will be allowed to handle the equipment. In the second year, especially, you will be observing them, how they are handled and how they are to be maintained. And in the third year, you might get to handle them a bit. And during your internship, you will be sometimes allowed to do independently as well in assisting the anesthesiologist. So that is how your training program is going to be. So your job is going to be totally, your training period is going to be totally within the operating room in the operation theater complex, which is usually temperature and humidity controlled at around 18, 20 degrees. And so your working is going to be in a very cool and comfortable environment. So the learning process becomes, stress-free from that aspect. But you should remember that anesthesiology is a high-stress situation. It is often equated to the aviation industry. So you will need to, that is why this is a stepwise, learning where first year is more of theory, second year is more of observation, third year is a little bit of assisting the qualified people, and internship, you will be allowed to do things independently, of course, under supervision though. So that is a graded approach that we employ in our institute, so that you are well versed and well trained, and you develop the skills and the agility. Sometimes anesthesia procedures have to be done in a very short span of time because it could be an emergency. So you have to be quick and agile in assisting the anesthesiologist in performing all these things. So that's how your program would run. And once you finish the internship is a 1-year compulsory program, and any leaves apart from the allowed leaves would have to be done as an extension for you to get the necessary certificate. And only on completion of the internship, 1-year internship, do you get to qualify to appear for the award of the certificate in the university convocation. So if you have not completed the internship, and even if you have cleared your theory exams, you still don't qualify to get the certification from the university during the convocation. So you will have to complete that as well. Once you get your B.Sc anesthesia certificate, then you are called as an qualified anesthesia technician or a technologist, as we call it these days. And you are eligible to work as an anesthesia technologist in and around the country or abroad, which includes the Gulf, the Middle East, the Western countries like Europe, UK, or even Australia and other places. As an anesthesia technologist, like I said earlier, in our institute, it's a purely anesthesia technology program. But in some places, they do combine operating theater technology along with anesthesia technology. So those candidates might be able to handle the surgical equipments and assist the surgeon or the operating nurse as well. But in our institute, it's highly specialized. So we have it only as an anesthesia technology program. So you may not be exposed to the surgical equipment or especially the handling of it, though you might get to observe them. Why I would like to highlight this is in some places, they do want a person not just catering to the anesthesia side, but they also want the person to cater to the surgical side. That's why the anesthesia technology and operating theater technology is combined in some places. But as we advanced, as anesthesiology advances, as medical science advances, we are more into specialization. So many places are now opting for separate anesthesia technologist and operating theater technologist. So there you would stand to gain because your knowledge and skills will be far superior to that of someone who has done both the programs. So this is about the course and the program. And as the duties of an anesthesiology technologist, I would like to highlight a few things over here. There, as an anesthesia technologist, one thing you have to remember is you might be the first to enter the operating room to set up the operating room, the anesthesia equipment, the anesthesia workstation, as we call it, which is the main equipment with which we provide anesthesia to the patients. And there are a lot of other equipment that has to be kept ready. All the drugs have to be prepared, the anesthetic drugs and the emergent razor, everything has to be prepared, labeled correctly, because we cannot afford to have any mishaps during anesthesia. Like I said earlier, this is often equated to the aviation industry. So like in the aviation industry where they have a checklist, the anesthesia technologist also usually has a checklist of things that have to be looked into and kept ready before the start of anesthesia. And during a day, you could have multiple surgeries. So at the end of each surgery, you have to look into the checklist again to see if things are all ready for the next particular surgery. So that is the primary role of an anesthesia technologist in getting all the equipment ready, so that anesthesia can be provided smoothly without any hindrance to the patient. So all this will be taught to you. And at the end of the day, again, you will also be interested in seeing to that all the equipment that was used are in place. Some of the equipments would be disposable of nature, where you have to dispose it in the proper way, because that is mandatory as per as licensing in the institutes and for the patient and healthcare professional safety. So disposal of equipment which are to be disposed will have to be done in the proper way. Again, you will be taught to do all that. And one important concern during surgery and anesthesia is of that of hand hygiene and maintaining utmost sterility inside and outside the OR. Again, you will be taught to do all these things as well, and you will have to ensure that all these are catered to. Another important aspect of an anesthesia technologist is to remember that, like any other healthcare specialist, you and I are at risk for exposure to infections or problems which is unique to the profession. So you will be taught about those risks, those infections, or those healthcare associated events that you can be exposed to and or you're at risk. Like sometimes radiation risk is there inside the OR. Risk of getting bloodborne infections like hepatitis and all this exists. You might get patients who have infections. So you will still you'll have to handle them. So you'll be taught the right way to handle such patients. And you have to ensure that you are safe at all times, and your safety is always your responsibility, because another person will be taking care of their safety. So nobody will be able to help you, especially once you are a qualified anesthesia technologist. All this will be taught to you during the course period, and you'll have to make sure that you adhere to all these practices so that you remain safe and you don't get exposed to any professional hazards during your work. Again, all these will be taught during the course period. So once you are qualified and you are performing the role of an anesthesia technologist, the next question comes is, what are the prospects of this particular course? Are there postgraduate courses available for this? So let me delve into that a little bit. So the MSc programs have been started in many allied health science courses, and we have a few of them in our institute as well. But anesthesia technology, to the best of my knowledge, there's no MSc program in the state of Kerala as of now. And we also do not have that program. But in some neighboring states like Karnataka and Tamil Nadu, they do have the MSc program of anesthesia technology. They could be doing more or less the same word, but with extra qualification. So they might be considered for some senior role, or doing the MSc programs especially would qualify one person to becoming a tutor or a lecturer for B.Sc programs in various institutes. That's one advantage of doing the master program. As far as job prospects are concerned, as of now, currently, I will not be able to say whether doing an MSc program would be of added advantage. Some institutes or some places, they could consider that, but since it is not mandatory that an MSc program is required. From a job perspective, whether doing an MSc program would be advantageous, I'm not able to commit that yet. But of course, for a teaching post, you would be considered above a B.Sc person. So once you do an MSc program, you will definitely be considered for a teaching program for the B.Sc courses. After MSc, as you all know, no longer the MPhil is no longer a requirement. So doctorate things people do think of applying. But again, since it's a growing specialty, how much are the prospects of doing a doctorate? is only time can tell us. But there are other allied health specialties which where we are seeing people doing the doctorate program. So it could slowly come up in the anesthesia technology field as well. But again, after having done that, what are your job prospects or what are your prospects will have to be seen. As of now, with a B.Sc degree, you do qualify to become an anesthesia technologist, and the prospects are ever increasing with the need with more and more hospitals with highly specialized anesthesia procedures being done. Earlier, the anesthesia technologist was not there. There was one assistant assisting the surgeon, the nurse, and the anesthesiologist. That's how it used to be. But from there, we have grown as a specialty. So the need for having a highly skilled anesthesia technologist is very important. So even a small hospital with one or two operation theaters would want the services of an anesthesia technologist. So your job prospects are definitely there within the country, outside the state, within the state. Definitely it is there, and also abroad. So many people think of going to the Middle East. That's always first line when for Keralites especially, or there are other places as well where do people go, like the Malaysia and Singapore and all those places. But of late, the destination has been either Europe, mainly UK, Germany, or Australia mostly. And there has been a significant increase in the intake of anesthesia technologists in UK. Earlier, it was non-existent because they didn't have a separate post like that. They have what is called as an operating department personnel. That is the name given to the anesthesia technology there. But they are taking anesthesia technologies into that particular post where they have what is called as a HCPC registration, which you have to do. This registration is accepted both in the UK and in Australia. So once you get to do the registration, of course, it takes time and all that. And provided you have the required English language skills, you might get to apply for jobs in the UK, Australia, and all. And for other countries in Europe, like Germany and Netherlands and some other countries also, they do have started taking anesthesia technologies from India. So the prospects are increasing in the Europe as well as in Australia. But currently, the prospects of anesthesia technologies moving to Canada and America is very, very limited. They're yet to open up for this particular specialty, though some other specialties, the requirement is there. In Canada and US, mainly the anesthesia technologist is not a direct course. It is to be done after the nursing as a nurse anesthetist, as they call it. So that's how it is in the Canada and in the US. So currently the prospects of going to Canada and US after anesthesia technology is not great. But in UK, Australia, New Zealand, and other European countries, the prospects of moving is there. And one way of going to Canada or even to UK and other European countries is to do a master's in an allied health program, not necessarily anesthesia technology, some other allied health programs, masters, you are eligible with your B.Sc in anesthesia technology degree. So some people do opt for doing those master programs and then subsequently move into jobs in that area. So you will be moving away from the field of anesthesia technology when you do such a master's program. So these are all some of the prospects of doing and this program. But you have to remember, wherever you go, as long as you're in the field of anesthesia technology, even in the country, in the Middle East or in the UK, you are going to be in a very responsible job, in a very highly demanding specialty where emergencies are the rule of the day and mishaps can happen, but you have to ensure that you are performing to the best of your skills and ability. And that is what Amrita Institute is known to provide you with the kind of training that you get in and with the kind of exposure and experience that you would gain from here. You would really stand to do good wherever you go. And this program will really, especially when you do it from our institute, it's very well known, and we have a very high ranking in the rankings of medical universities. You not only you get a degree from a highly ranked university, your skills and knowledge is going to be tremendous so that you can perform well wherever you go, provided you stick to the basics and you perform true to your potential. So with that, I would like to conclude my talk, and I'm open to take up any queries that are there.
Thanks a lot, sir. We have Gunjan Gupta with some doubt. Gunjan,
Yeah.
can you unmute and speak what you have to ask doctor? Gunjan?
There's something in the chat box. I cannot open my chat box for some reason.
What are the Gunjan has some other doubts, sir, but there is some doubt. One doubt here. What are the research possibility to introduce new drugs?
New drugs, the research happens more from a pharmacy and pharmaceutical point of view. So the role of an anesthesia technologist in research into new drugs as such might not exist, because this is more of a technical job where you are into gadgets and equipments and things like that, rather than directly into drugs and research into new drugs. New drugs research would probably be more from a PharmD or pharmacology sort of a perspective as such.
Okay. Sir Gunjan, Gunjan, once again, I give you a chance. You could ask doctor your doubt. Please unmute. Sir,
Not sure. Yeah.
sir,
If
I
you
would,
put in
I
the
would,
chat box, it will be nice if she's not able to connect.
yes. You could also drop your doubt in the chat box. We could answer that. Doctor, I have a couple of questions, doctor, to ask you just on behalf of these attendees.
Sure.
Now, as you had said, like, what would be the key skills that these anesthesia technology students should focus on if they have to develop, like, succeed in this field?
uh, Key skills would be to have good knowledge, first of all the equipment, anesthesia equipment, because it's a growing specialty. So every day a new equipment or a new gadget is being introduced. So the skill set that they will need to develop is to quickly pick up how a new gadget or equipment is to be handled, and including a basic maintenance, and to handle them in a quick and efficient fashion, because like I said, anesthesia, sometimes you don't have much time to do things, unlike the surgical specialty. So their skill set will not only be in learning the newer gadgets, handling them, but handling them efficiently and in a quick fashion. That is something that they will have to do. And there are no shortcuts in anesthesia. So everything which has to be done in a specific stepwise fashion will have to be done in the same stepwise fashion, but at the same time that will have to be done quickly. So the importance is to anticipate what the anesthesiologist would ask you, rather than from a surgical side. If you see, they can wait for the surgeon to ask them for something and then provide with it. But here, as an anesthesia technologist, it will be important for you to be really skilled enough and knowledgeable enough to understand and anticipate what the next step is, and to be ready with that thing, so that the anesthesia goes hitch-free and without any problem.
Okay, thank you, doctor. So, doctor, as you had just said, like, there are some gadgets to be handled by the students. Could you name some of them? Like, just
Yes.
anxious to know what are the gadgets, the
There's a
name of the gadget.
huge list. There's a very big list. Very difficult for me to say. Anesthesia
Okay,
workstation,
okay,
which used to be called anesthesia machine, is the most important of the gadget that they will need to handle. It's a big sort of equipment
mm,
with multiple functions in it. And it comes with basic monitoring, which has a ventilator, monitor, gases are to be supplied through that and all that. So anesthesia workstation is one of the most and the important of the gadget or equipment that they'll need to learn. And there are a host of other equipments which are used in providing anesthesia. And some of these equipment overlap between anesthesia, OR, or some other specialties with anesthesia, like an ultrasound. Ultrasound is something, it is being employed by every specialty. So ultrasound is used by the anesthesiologist. We will have to learn to handle the ultrasound machine. You'll have to learn to handle the defibrillator, which is the machine that gives shock to the heart in very specific situation. So these are some of the things that I could immediately mention, but there's a host of equipment. It's a big list. They will be taught to handle each and every one of them over the period that they're going to be with us.
Thank you, doctor, for that. So there is another question. Like maybe it's a confusion because we do not have AT and OT together here, but in many other colleges, like they have AT and OT together. So there is one candidate who's asking the difference between OT technology and anesthesia technology.
Yeah, the operating theater technology, if we have to specifically stick to that terminology alone, they assist the surgeon and they handle equipment which the surgeon uses or the operating nurse uses. So the anesthesia technologist handles equipment which the anesthesiologist uses. So both these equipments are totally different. But from the beginning, it has been the same person who has been assisting the surgeon and the anesthesiologist. But of late, the two specialties have separated out. But in some institute and some places, including the government-run program in Kerala, it is AT and OT is combined, so they get to learn both the equipment. But many places they've separated out, and in our institute, it is anesthesia technology is a separate program. Operation theater technology is a separate program.
Mm. Thank you, sir, for that. Sir, maybe if they have any more doubts, we could ask them or they could tell us. But before that, we have Shanley from the admissions. So just tell these attendees about the admission process this year very fast. Shanley.
Thank you, ma'am. My name is Shanley. I'm from Kochi admission office. I'm here to explain the admission process of B.Sc Anesthesia Technology. As you all know, we have various B.Sc Allied Health Science courses offered in Kochi and Faridabad campus. In Kochi, we have around 17 Allied Health Science courses. And all the selection for the Allied Health Science, B.Sc Nursing and Pharmacy is through Amrita Entrance Examination, AEL 2025. So as you can see, these are the various 17 courses offered here, and anesthesia technology is one among that. The course duration is of 4 years, in which the candidate should undergo a compulsory 1-year internship in the final year. And in terms of eligibility, the candidate has to appear Amrita Entrance Examination, which in short is named as AEL, and thereafter there will be an online interview. Coming to the age eligibility, the candidate should be minimum of 17 years of age and maximum of 23 years of age as of the academic year. And the candidate should pass +2 with the minimum aggregate of 60% in physics, chemistry, and biology. This is the first year fee structure. The admission is offered through 3 different categories: scholarship, non-scholarship, and NRI. In scholarship, the tuition fee is 1,80,000. In non-scholarship, it is 2,60,000. And in NRI category, it is 4,500 USD. There will be a first year other fees of rupees 41,000, and also an admission processing charge is collected in the first year, that is 2,500, and hostel and mess of rupees 80,000. If the candidate is residing within 20 kilometers of the campus, hostel is not compulsory. As I said, the selection is through Amrita Entrance Examination, Life Science, Agriculture and Medical Sciences. The entrance tentative date is the 3rd week of May 2025. Mostly it will be around May 18th or 19th, and it will be conducted in 3 slots: morning, afternoon, and post-noon. So each candidate will have exam at any one of the slot selected by the candidate. So before the entrance examination, around in the time of 1st or 2nd week of May, the registered candidate will be getting a notification in their mail ID telling them to book slot for the entrance examination. So a link will be provided in the mail, and through the link you have to select the date you are interested to attend and the slot you are interested to attend. So based on that, exam center will be allotted to you. This is the question paper pattern. There will be 4 subjects: physics, chemistry, biology, and English. 25 questions from physics, chemistry, and biology, and 5 questions from English. So total there will be 80 questions where each correct answer will be awarded 3 marks and the wrong answer will be awarded -1 mark. It will be a multiple choice question and based on a computer based test in the allotted centers. So the detailed syllabus and the information handbook is already updated in this website. Just take note of the website. It is amrita.edu/admissions/AL. And the candidates, please take note of this website also. Amrita admission website, amrita.edu/admissions, and the AEL website, which I already mentioned, and the program website, amrita.edu/program/BSc Allied Health Sciences, where all the fee structure, course details, eligibility of the allied course sciences, allied health science courses are already mentioned here. And this is the application portal, applyug.amrita.edu. So this is the application portal. Most of you have already registered. So already registered candidates can log in using your mail ID and password. Those who have not registered, you have to freshly register by entering your name, mail, and mobile number. So as you move forward, you have to fill the basic personal information. And in the next step, various campus of Amrita and the UG courses are mentioned in the right side of the pane. So in whatever programs you are interested, you can apply through this step. So B.Sc Anaesthesia Technology is offered in Kochi and also in Faridabad campus. And later on, when you move forward, you'll be asked to select 3 city preferences for attending the entrance. Then, if you are interested in anesthesia technology in both campus, you can select both the program in Kochi and Faridabad also. Move to the payment option. You have to make a payment of rupees 550. So for all the courses which is coming under Amrita Entrance Examination Life Sciences, you have to pay rupees 550 and you can give multiple options for the courses coming under exam. And this portal also contains other courses which are not there in the life science. So for that courses, you have to pay extra. And proceed with the payment. You have multiple options for the payment. And later on, you have to update your academic details, your 10th branch percentage board, and your 12th state year of passing. And if you're awaiting for your result, you can select the option awaiting. Suppose you have attended your +2 the previous year, you can select the option published. And if you're selecting the option published, there to the below of this screen, you'll be asked to enter the marks of the subjects. And you can proceed forward. Anyway, our entrance will be in the 3rd week of May. So by that time, your results will not be out. So by the last week of May, when your 12th results are published, you have to log into this particular portal. You have to change the status from awaiting to published. Then you have to enter the individual marks of physics, chemistry, biology, and English if required. Then in the document session, as of now, you can upload the documents which are rightly available with you now. And later on, when the results are published, you have to upload the copy of your 12th mark sheets. So just take note of these details. As I said earlier, a slot booking option will be coming to your mail mostly by the 1st or 2nd week of May 2025. So that time, using the link provided in the mail, you have to book your slot and the date of entrance examination. The allotment of the date and slot will be on the first come, first serve basis. Suppose if the candidate is not exercising their option, automatically the slot will be allotted as per the availability. So after completing all the registration formality, each and every candidate are instructed to take a note of your registered mail ID, password, and your registration number. So as we have noticed earlier, some candidates, while registering, they have given the registered number, like they have Akshaya Center numbers they have given. So please change it. You can send mail to ugadmissions@aims.amrita.edu if required, because the notification, the webinar, everything, webinar notification, everything will be given to your registered mail ID and registered number. So make sure that everything is correct. And also, if you have any admission related queries, just take note of these numbers. And please note that the University Amrita Vishwa Vidyapeetham has not appointed any third party or agents for securing admission in the university. Thank you.
Thank you, Shanley, for the detailed explanation of the admission process. Is there any doubt from anyone else? You could just ask now, or else I think it is time to come to the conclusion of this webinar. A doctor is very much engaged with his profession, and he has to leave, and so he has left us. But I would be thanking each one of you and doctor, because even after his hectic schedule spent here in the hospital, he had taken his time to be with us, to give us such an information about the anesthesia technology course, the program. And as you had no doubts, I hope you have understood what this course is in Amrita and why you should be choosing Amrita, especially for this wonderful course here with such a lot of expert doctors with us to spend your valuable time when you are with us. So I once again, as we approach to the conclusion of the session, I am grateful to Dr. Shyam for spending his time with us, and each one of you have joined us today for this webinar. So I think we could conclude today's session. Thank you once again for joining, and hope to see you soon with us. Thank you.